session now. So as much as possible, we will try to simplify things in pharma so that we can remember more. So in this session, I'm not going to say anything much more than what is given in this notes, so that these notes should be clarified and made sure that you will memorize this. So in other subjects, you can try for expanding points, but I think in pharmacology, we will limit to our notes. So to start with, so general pharmacology, that's what we are starting with. So we have some definitions here: dynamics, kinetics, genetics, genomics, and vigilance. So these are the definitions. So pharmacodynamics means the action of drug on the body that are termed pharmacodynamic process. Kinetics means the action of body on the drug. Bioavailability means rate and extent of absorption of a drug from a dosage as determined by its concentration time curve in blood or by its excretion in urine. Genetics means study of genetic basis of variability in drug response. Genomics means genetic information to guide choice of drug and dose on individual basis. Vigilance means science and activity related to detection, assessment, understanding, and prevention of adverse effect of drug and other drug related problem. So when you get these questions, certain keywords you should know so that easily you can crack this MCQ. So dynamic means drug on body, action of drug on body. Kinetic means body on drug, drug on body and body on drug. Okay, bioavailability means rate and extension of absorption. So bioavailability talks about absorption of a drug. Absorption of a drug. Okay. Next, genetics means genetic basis. So I don't have to tell that. Genomics means choice of drug. So it helps to guides us by letting us giving the information for the choice of drugs and dose on individual basis. So genomics talks about the choice. So that point you need to know. Genomic talks about the choice. Bioavailability talks about the absorption. Pharmacovigilance talks about the side effects, adverse effects, that is side effects. Vigilance means side effects or drug related problems. So vigilance talks about the problems. So these keywords you need to remember. So drug on body, body on drug, absorption, choice of drug, vigilance, that is problems or side effects of drugs. So these key points are must. I hope this table is clear. Then comes another set of definitions where you have something called clearance. So clearance talks about filtration. So clearance is rate of elimination plasma concentration. So clearance talks about filtration. Next is volume of distribution, talks about a hypothetical volume. We don't know the exact volume, a hypothetical volume in which the drug is distributed. So distribution talks about distributed. Okay, so the definition we have is VD equals amount by plasma concentration. Amount by plasma concentration. Most common mode of drug absorption is passive diffusion. So dose response curve. For a drug we have dose response curve. This is the relationship between log of dose and response. So we have a slope. That indicates the slope indicates the safety. The x and y axis. So x indicates the potency, y axis indicates the efficiency, height indicates the efficiency. So these 3 points you need to know regarding dose response curve. I think dose response curve will come as a picture. Next is thalidomide, which is the most potent teratogen. That's also one of the example, one of the regarding the dose response. Next is half-life. The definition of half-life is time taken by the drug to reduce its concentration by 50%. So time taken by the drug to reduce its concentration by 50%. So half-life means time. Half-life talks about time, reduction in time. Okay, reduction time taken for reducing the drug's concentration. So I repeat, clearance talks about filter. Clearance talks about filter. Half-life talks about time. Distribution talks about distribution. Okay. Then we have something called kinetics, zero order kinetic drugs. So zero order kinetic drugs, we have a list: warfarin, aspirin, alcohol, theophylline, phenytoin, tolbutamide. Out of which warfarin and phenytoin are very important for your MCQ. Warfarin, phenytoin, highly repeated MCQ. Okay. Drugs that work through different mechanisms. Drugs work through different mechanisms. Here we have drugs that work through nuclear receptor and drugs that work through nuclear mechanism. Someone's mic is on. Please turn it off. Yeah. So drugs that work through nuclear receptors are vitamin A, T3, T4, and sex hormones. Drugs that work through nuclear mechanism is, I repeat, vitamin A, T3, T4, sex hormones, and corticosteroids. So with receptor, these three, vitamin A, T3, T4, sex hormones, with mechanism, under the nuclear mechanism, vitamin A, T3, T4, sex hormones, along with that corticosteroids. Okay. Then the next question is drugs that treats overactive bladder. So these are basic MCQs that you need to know before even entering other stuff. So overactive bladder drugs treatment are sulfenacin, darifenacin, oxybutynine, flavoxate, tolteridone, mirabegron. Drugs that cause hirsutism, they are phenytoin, cyclophenac, minoxidil. Drugs that cause hepatitis, they are halothane, MAO inhibitors, steroids, isoniazid, rifampicin, pyrazinamide, methyl-dopa. Hepatotoxic drugs are paracetamol, tetracycline, methotrexate. Okay. So two mnemonics I would like to give here because they are very important. First mnemonic is drugs that causes hirsutism. You remember by the mnemonic PCM. PCM. So P for phenytoin, C for cyclophenac, and M for minoxidil. Hepatotoxic drugs you can remember PTM. Paracetamol, tetracycline, and methotrexate. So you can make it PTMX, methotrexate. Okay. So these two are highly important in them. Then comes prodrugs. So here are the list of prodrugs. Often you get a question from this. So the list of prodrugs are dipeprin, levodopa, enalaprine, azathioprine, alpha-methyl-dopa, ampicillin, dipeprin we have already covered, Cilindac, sulfasalazine, fluorouracil, proguanil, prednisone, sulfasalazine, cyclophosphamide, okay, mercaptopurine, acyclovir, lovastatin, and simvastatin. So these are the list of prodrugs. So the list actually keeps going, but these are basic prodrugs you should memorize. So from now we'll go by topics, specific topics in pharma. So we're starting with ANS, autonomic nervous system. Now, so ANS talks about different receptors that are present in our body and where are they located, and if we give a drug to either block them or to activate them, what happens? So this is what is being dealt with ANS. And this is what will be asked as a question in ANS. So what and all questions we can get from here is, number one, the receptors. So the receptors in ANS and where are they present location. So we'll first see about them. The first is alpha receptor, next is beta receptor, and the next is N and M receptor, nicotinic and muscarinic receptors. So alpha are of two types. Alpha 1 is present in smooth muscle and gland. So if you start blocking it, the smooth muscles and glands will be affected. So alpha 2 are present in presynaptic nerve terminals and postsynaptic vesicular smooth muscles and also in brain. Beta 1 are present specifically in heart and juxtaglomerular cells of kidney. Beta 2 are present in blood vessels, lungs, GIT, bladder, uterus, skeletal muscles and liver. Beta 3 are present in adipose tissue and bladder. Nicotinic or NN and NM, NN receptors are present in ganglia, adrenal medulla. NM are present in neuromuscular junction. M1 is present in CNS, gastric gland, autonomic ganglia. M2 is present in heart and M3 is present in smooth muscle, glands and endothelium. So this table, there is no option but other than memorizing, out of which the most important for your examination will lie in only few things. Number one is beta 1 present in heart. Beta 1 is present in heart. So that is the first thing. Then beta 2 is important because it's everywhere. When you block beta 2, lot of actions can occur. Then NM, that is present in neuromuscular junction. And then M3, that is present in smooth muscle, glands and endothelium. So these are highly important in this topic. Moving forward, so we have two important drugs, that is the drugs which acts on the sympathetic system and drugs which acts on the parasympathetic system. So we are going to see first drugs that are directly acting in sympathetic system. So they mimic sympathetic system. So these drugs are called sympathomimetics, directly acting sympathomimetics, which means when the sympathetic system is activated, what and all will be carried. If you give these drugs, that actions will be carried. So sympathetic system, drugs acting sympathomimetics. Can everyone hear me? Okay, good. So for going into these drugs, we need to know something. So what do the sympathetic and parasympathetic do? So sympathetic and parasympathetic, their actions we will just see so that we can understand better for this table. So in pupils, sympathetic dilates the pupil. So it dilates the pupil. Parasympathetic constrict the pupil. Sympathetic dilates the pupil. Parasympathetic constricts the pupil. Number 2 is saliva. Sympathetics block the saliva, they inhibit the saliva. Parasympathetic, they stimulate the saliva, so high saliva. So sympathetic reduces the saliva, parasympathetic increases the saliva. Third is the heartbeat. Sympathetic increases the heartbeat, parasympathetic reduces the heartbeat. Next is lungs, the airways. Sympathetic relax the airways, relax the airways. Parasympathetic constricts the airways. I hope I'm clear till now. I will repeat after I'm done with this. The next is gastric, so stomach. So sympathetic inhibit the action on stomach, activity of stomach. Parasympathetic increases the activity of stomach. That is acid production and digestion. Sympathetic inhibits the gallbladder. Parasympathetic stimulates the gallbladder. So bile acid flows when parasympathetic tone is on. Same goes for intestine. Okay. Then last is bladder. Sympathetic relaxes the bladder, whereas parasympathetic contracts the bladder. So all of these are MCQs. Now, how to remember all of them in a single go? Imagine a dog. A dog is chasing you and you are running. You're running on road. So you keep running. So this is sympathetic. So what happens when you run? When you run, you should know the ways to escape. So this is a fright and flight response. Let it be dog. If some people are not scared of dog, maybe we can keep it as lion. A lion is chasing his guy. So he's running. So this guy will have to find a lot of ways to escape. So his pupil gets dilated. So dilated pupils. This guy's saliva is reduced because as much as possible the blood has to hold within itself, so it can give a good blood supply to brain so that it can keep on running to save himself. The secretions will reduce. So any secretion will reduce. Only one secretion will be active, that is sweating. Sympathetic causes sweating. So this patient will sweat. What happens to his heart rate? He keeps running. So the heart rate rises. The heart rate rises. What happens to the airways? The airways will relax because lot of air has to enter and leave. Because he keeps running, his respiratory rate will increase. So a lot of air is needed in his lungs so that he can have oxygen for his brain, for his heart, for everywhere in the body. Then what happens to his stomach? So at this time, saving his life is important, not digestion of food is important. So everything relating digestion, GI, anything regarding GIT is blocked. Anything regarding gallbladder, GIT, intestines, stomach, everything is blocked. Can he activate his urinary system? No, at this time he can't because he keeps running. So when you want to know what does sympathetic system do, just imagine this picture. If you are being chased by a lion, when you run on streets, your sympathetic activity will be at its height. So that's it about sympathetic. So now if you see this table, it is going to be very, very simplified. Okay. Now, so when we give a drug which act like this sympathomimetic, which means when you run, what and all might happen, if you give these drugs, same effects can happen. So that is directly acting sympathomimetics. So we'll start here with the first one, that is catecholamines. So catecholamines means they are of endogenous and exogenous types. So the endogenous type of catecholamine is, the first one is dopamine. So dopamine is used in condition where there is a shock along with less urine output, shock with oliguria. and in CHF, congestive heart failure. This is actually the most important MCQ of this entire table. Dopamine is used in shock with oliguria and CHF, congestive heart failure. Number 2 is adrenaline. Adrenaline is used in anaphylaxis, cardiac arrest, and prolongs action or reduces adverse effect of local anesthetics. Local anesthetics. So when you mix adrenaline with a local anesthetic, for example, lignocaine, its action will be longer and its side effects would be lesser. Next is noradrenaline. Noradrenaline is used in shock or in CHF. Next is exogenous. Exogenous means dobutamine, phenoldopa, isoprenaline, and dopexamine. So dobutamine means you can give in CHF. Phenoldopa means you can give in hypertensive urgency. Isoprenaline means CHF and asthma. Dopexamine means you can treat heart failure following surgery. So these are the uses of that. Next is non-catecholamines. So we are done with catecholamines. Next is non-catecholamines. I think I'll quickly repeat catecholamines. So you need to remember dopa, adrenaline, noradrenaline, dobutamine, phenoldopa, isoprenaline, dopexamine. All of them are emergency drugs, out of which at least you must remember dopamine, adrenaline alone. You should remember. So dopamine is used in shock plus oliguria or CHF. Adrenaline, anaphylaxis, arrest, and reduces adverse effects. So adrenaline, I want you to remember AAA. Adrenaline, anaphylaxis, arrest. Dopa is shock plus oliguria. DSO, dopa, shock, oliguria. Okay. Noradrenaline, shock and CHF. Dobutamine, CHF. Phenoldopa, hypertensive urgency. Hypertensive urgency. Isoprenaline, CHF and asthma. Dopexamine, treat heart failure following cardiac surgery. Next is non-catecholamines. First, we will block the alpha-1 receptor. Here we saw there are a lot of receptors. So here we saw. So one by one, when you block the receptors, what is going to happen? So alpha-1 is responsible for smooth muscle and glands. So any effect that is going to happen is going to affect the smooth muscle and glands. So here it's agonist. So it is activating the alpha-1. So phenylephrine is going to cause mydriasis. Okay, that means dilates the pupil. So you can use phenylephrine when you have to check in glaucoma. Next is midodrine, methoxamine, mephentermine. This will treat shock. Next is xylometazoline, oxymetazoline, nafzoline. These are used as nasal decongestant. Next, clonidine. It has multiple use, so this is definitive MCQ. You need to know. Other than being an antihypertensive, it is also used as a migraine prophylaxis. It treats attention deficit hyperactivity disorder. It controls diarrhea in DM patient with autonomic neuropathy. Very important, NEET PG MCQ. It treats withdrawal symptoms of alcohol, opioid, nicotine. So in these 5 points, I want you to remember 2 main points. Antihypertensive, yes, clonidine is antihypertensive. Everyone knows that. I want you to remember clonidine as treats attention deficiency hyperactive disorder and controls diarrhea in DM patients with autonomic neuropathy, because it is asked in NEET but not yet in FMG. So you should expect this question in FMG. Next is methyl-dopa. Methyl-dopa antihypertensive, straight question. Next is apraclonidine or bromonidine. This is used in topical treatment of glaucoma. Next is dexmedetomidine. It is used as a pre-anesthetic. Next is tizanidine. This is used as muscle relaxant. So out of all these topics, the most important one is going to be clonidine. This is the most important one. And in alpha-1 agonist, the 2 most important ones are, I said already, clonidine is important. Other than clonidine, it is phenylephrine. Clonidine and phenylephrine are the most important in them. So at least these 2 you must be able to memorize. Then comes the beta-1 agonist. So beta-1 agonist drugs, if you see, the name of the drug is prenaltrenol. So this is just a reversal of beta blockade. That's it. So when you given beta blocker and there's acting a lot and you have to get a reversal effect of that, you will be needing beta 1 agonist. Beta 2 agonist is SABA or LABA, short acting and long acting bronchial agonist, a beta agonist, sorry. So salbutamol is a drug that is a short acting bronchodilator, whereas salmeterol is a drug that is long acting bronchodilator. So to know that, if you see the word metro, it is long acting. Metro, if you see, it is long acting. So meterol. Okay. So this is used in asthma, acute asthma. Then you have ridodrin and isoxaprine. These are used as tocolytic. So one of the most famous MCQs, here is isoxaprine. It's a tocolytic. Saba Laba definitive MCQ. Almost once in 2 years or once in a year, you used to get this question. So Saba and Laba is a must. Then comes beta 3 agonist, mirabegron. Till now, this question has not been asked. This tricks overactive bladder. We have already seen the question regarding overactive bladder. Then comes D1 agonist, that is phenol-dopam. This treats hypertension. Then D2 agonist, that is bromocriptine. This is used in Parkinson's disease or prolactinemia. So bromocriptine is used in prolactinemia. This is more important MCQ than Parkinson's disease. Bromocriptine is used in prolactinemia. Okay. Then we go to the indirectly acting sympathomimetics. So we are still in the sympathetic mimetic drug, which means that activates the sympathetic system. So we're still in that way. So in this, we need to know that these drugs, cocaine, ephedrine, tyramine, amphetamine, modafinil, methylphenidate, these are there. In these drugs, the first one, cocaine, is a reuptake blocker. This is not MCQ. You need to know cocaine is used to cause hypotension. Cocaine is the only local anesthetic that causes vasoconstriction. That is why it increases the BP. So this point is highly important. So cocaine, so in that classification, cocaine, prelocaine, lignocaine. So in that classification, only cocaine can cause vasoconstriction. So it increases BP, so it is used in hypotension. Next is ephedrine. Ephedrine is used as a nasal decongestant. Treats hypotension is not very important MCQ. Adverse effect is urinary retention, hypertension and insomnia. That is also not much important. What is most important is nasal decongestant. Ephedrine, nasal decongestant. At least this point you need to remember. But what is most important is displacement drug. This itself is important. What are the drugs that causes tachyphylaxis? This is the MCQ. You need to first know the name of these 4 drugs to sort out the MCQ. Tyramine, amphetamine, modafinil, methylphenidate. So here, commonly they can ask like mirabegron is as one of the MCQ, methyl dopa as one of the MCQ, because methylphenidate, instead of methylphenidate, they can ask methyl dopa, and you can easily get confused. So you need to know these 4 names very clearly, displacement drugs. So tyramine leads to Cheese reaction in those who take MAO inhibitors, MAO inhibitors. Amphetamine treats narcolepsy, ADHD. Modafinil is drug of choice for narcolepsy. Methylphenidate is drug of choice for ADHD, attention deficit hyperactive disorder. This is what happens when sympathetic system is stimulated. Now we are going to see what is going to happen when sympathetic system is going to be blocked. So sympatholytic. So in this, first if we block the alpha, so when you block the alpha, so what happens here is you can have 3 different ways. Either you can block it totally, or you can block the first receptor, or you can block the second receptor. So when you block totally, it can be used in pheochromocytoma. So what drugs that are blocking alpha totally? Phenoxybenzamine and phentolamine. So you can remember pheochromocytoma for phenoxybenzamine and phentolamine. So all of them has pheo. Then selective alpha-1 blockers are those with OSIN, ozin, prazosin, doxazosin, terazosin, tamsulosin, all those OSINs. OSINs are used for BPH, urinary retention in BPH. Forget about this hypertension. Always remember urinary retention for BPH. They can ask this way, instead of asking the blocking agent, they can ask which of the antihypertensive drug that can be used in BPH as treatment for BPH. Your answer should be one of these four or alpha blockers. So next is selective alpha 2 blockers. This ends with INE. Tolazoline, mirtazapine, yohimbine. So these are not much used in clinically. So these you can forget when you are reading. So what you need to know: pheno for pheochromocytoma, osin for BPH. That's it.